two questions to ask you, part A and part B. You work in critical care. Where you work, you deal with people between life and death virtually every day. And thank you for saving lives, Dr. Brownhilda Santo. The argument for drinking alcoholic beverages is that we drink this thing and we have no symptoms. So part A of my question is, what are the symptoms of problems associated with drinking alcohol? Part B of my question is, what are the complications?
Okay. So, well, with acute alcohol intake, with alcohol intake, you may have acute intoxication symptoms. Patients will be wobbly. They could be dizzy, lightheaded. They may be talking off their head. Some people may be lethargic. So you have those acute symptoms. However, what I want to do is I will talk about the chronic, let's say the complications that will develop after a sustained heavy alcohol abuse over years. And then we can actually talk about some of the complications, the acute complications from intoxication. And I want to talk about the chronic ones first because, it could be really heavy, what I will say, and it needs a little bit of attention. So alcohol can affect so many organs. And one of them is the liver. So alcohol abuse can cause acute hepatitis, which just means that inflammation of the liver. And these patients can present with nausea, right upper quadrant pain, so pain around the area of the liver. Some of them may have jaundice, which is yellowing of the skin. And over time, with prolonged heavy alcohol use, patients can develop cirrhosis of the liver. And with cirrhosis of the liver, this just means that with the chronic inflammation, the liver cells have now developed scarring. You start having fibrosis of the liver. This will cause distortion of the liver architecture or the structure of the liver. And this will even affect, it will affect the functioning of the liver. You affect the blood supply of the liver. This patient's liver will now develop nodules, so which we call a nodular regeneration. So once you develop cirrhosis of the liver, then you are actually in really, really serious problem, because cirrhosis of the liver can lead to a lot of complications. Now, one of the complications of scarring and cirrhosis of the liver is what we call portal hypertension. And portal hypertension just means high pressure in the portal vein. And that's a major vessel that brings nutrients and toxins from the stomach, the intestine, the pancreas, the gallbladder, the spleen, and it all brings their blood supply to this portal vein. Now, it supplies 75% of the blood to the liver. The other 25 is by another vessel called hepatic artery. And then from the liver now sends blood now to the rest of the body through another vessel called hepatic vein. But let's go back to the portal vein. So when you have high pressures in the portal vein, we call this pulmonary hypertension. Now, with the pressures being so high, partly because the liver is not functioning well and it is all fibrosed, scarred up, and partly because there are some chemicals that are released that could cause constriction of these vessels. The blood flow from all those organs I just mentioned is impaired. And so what will happen is, because of the buildup in pressure, you have now development of some other vessels, what we call collateral vessels, and leading to what is called varices. And the pressures in these smaller vessels will now also start building up to the point where it can rupture and cause bleeding, and we can talk about that. So from cirrhosis and portal hypertension, we now have varices, which has these abnormal blood vessels. Now, sometimes because of the sluggish flow in the portal vein, clots can also develop, which will even make the pressures worse, called what we call portal vein venous thrombosis. Because of the cirrhosis and the portal hypertension, fluid can also start building up in the peritoneal or abdominal cavity. So these patients will have swelling of their abdomen. They will start building up fluid in their abdomen. Their abdomen will be distended. They will be uncomfortable. Sometimes they will develop shortness of breath because when your abdomen is so big, it impairs your diaphragm, which is an important muscle that you use to breathe. It impairs that from expanding when you're taking a deep breath. And so you will develop shortness of breath too. Sometimes this ascites or ascitic fluid can get infected. And sometimes the fluid can also seep through or pass through the diaphragmatic defects to the right pleural cavity. And the pleural cavity is the space between the lungs and the chest wall. And so it will cause what they call pleural effusion. And this will also cause a shortness of breath. And, if the fluid is not drained, you can actually go to respiratory distress. Now, some of these patients with cirrhosis can develop what we call hepatic encephalopathy. And by this, what I mean is there will be buildup of ammonia. Ammonia is supposed to be broken down by the liver and help in elimination. But because the liver is not working anymore, the ammonia will build up in the blood and crosses the blood-brain barrier and goes to the brain and causes the patient to become lethargic. They'll have altered mental status. They will, some of them will develop what they call asterixia. So if you ask them to extend their hands like this, when they do that, they will be flapping, just flapping like the wings of a bird. And if not treated aggressively, these patients can even go into a comatose stage or a comatose state. Sometimes the liver cirrhosis can also cause heart problems. Sometimes they can cause renal failure, kidney failure. So only by developing liver cirrhosis and portal hypertension, we've had other complications, including abdominal ascites. We've had pleural effusion. We've had kidney failure. We've talked about thrombosis, that's clotting in the veins. We've talked about hepatic encephalopathy. We've talked about infection of the fluid. So just that alone. Now, let's leave the liver for a minute and go now to another organ, the heart itself. Alcohol can cause toxicity to the heart and make someone develop cardiomyopathy. That's an enlarged heart leading to heart failure. So the patients can have shortness of breath. They can have swelling in their legs. They can actually develop irregular rhythm. Example is atrial fibrillation or AFib. And sometimes even without having a structural structural changes of the heart, some people who drink a lot at once, like binge drinking, those who can consume so many drinks at the same time, may actually have something that they call, they can also have arrhythmia, and this is as a result of the alcohol. Now, let's leave also, because alcohol can cause vitamin B1 deficiency, some people can develop what they call beriberi, which is still heart failure, and the patients will have all the symptoms of heart failure, but the structure looks intact, or the function of the heart, the contractility of the heart is fine, but they will develop right-sided heart failure. Let's move now to a different organ, the brain. The alcohol also has toxic effects on our nervous system, on the brain. So because of the vitamin B1 or thiamine deficiency, there is a syndrome called Wernicke-Korsakoff syndrome. And these are just two syndromes. The Wernicke is the acute phase of the syndrome, and the Korsakoff is the neuropsychiatric late phase. And with the Wernicke syndrome, the patient will have encephalopathy. They'll have altered mental status. They'll be disoriented. They could be indifferent. they will develop eye movement disorders. They will develop gait disorders, so they can't coordinate. Some of them walk slowly, and sometimes they may be unable to walk. Now, this can progress to the Korsakoff syndrome, which is mainly amnesia, and amnesia meaning that memory deficits. And so the patients may develop what they call anterograde or retrograde amnesia. Anterograde meaning that they can't remember events that happened after they develop this syndrome. And the anterograde, they can't remember events of the past. Sometimes they can't even remember events that happened just few minutes prior. And the patients sometimes will even develop what they call confabulation, meaning that they, because of the memory gaps, they will actually make up stories to when they are trying to recall something that happened, and they believe so much in what they are saying that you can't convince them because they're unaware. They can have apathy, they can have poor insight. Alcohol can also affect another part of the brain called the cerebellum. And that part of the brain is important in movement coordination, in precision and timing. So the patients will pretty much be walking like a drunkard. So you may think that they have drank alcohol, but no, they may not have even been drinking like acutely, but this is because of the side effects. Now, let's go to another organ. The esophagus, that's the food pipe. It can cause esophagitis, which is inflammation of the esophagus. It can cause gastritis, which is inflammation of the stomach. It can cause ulcers, both in the stomach and the duodenum. And if these ulcers happen to be, if there are blood vessels in that area, it can erode, the ulcers can erode that blood vessels and cause bleeding. Let's go to the pancreas. The pancreas is another vital organ in the body. It can cause acute pancreatitis. The patients will come in with pain, severe pain. They'll describe it. It's in their left upper quadrant area. They'll describe as a sharp pain that is going to the back. They'll have nausea, vomiting. I mean, as you can see, there's a lot. Alcohol, especially over a prolonged period of time, can cause nutritional and vitamin deficiency. It can cause peripheral neuropathy, meaning they'll have tingling sensation, burning sensation, numbness in their extremities. It can cause electrolyte abnormalities. So I don't see anything really good about this if we have to talk about this. And these are just the chronic. With your acute, I'll talk briefly about the acute intoxication. Patients it can cause accidents, we know that. And in the US, although the legal limits, the alcohol legal limit is 0.08 grams per deciliter or percent, it has been shown that patients are actually, people are actually impaired even with levels as low as 0.02. And the chances of collision doubles when your levels are 0.05. It can cause violence. It has been shown that half to two-thirds of homicides have alcohol-related issues involved. Alcohol is also involved in about half of cases that involves serious assault, and in more than 1/4 of cases that involves rape. Alcohol can cause suicide, especially if the patient has depression and takes other substances. So having said all of this, I'm trying to figure out how can alcohol really be a good thing?
In my cup, I don't want to see alcohol in my cup. No more. No more. Listen, I thought that alcohol does a little beyond just getting you drunk. After listening to Dr. Brownhilda Santo, I could not take that glass again. The glass is empty. I couldn't sing that song. In my cup, in my glass, I want to see alcohol in my glass. Empty.
Just nice Africa, 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 just nice Africa.